Hi everybody, I'm Kendra. I am standing here today with a good friend of mine, Dr. Choll Kim, who is a renowned spine surgeon in San Diego. One of the best, right?
Yes, I'm a spine surgeon and I specialize in minimally invasive surgery. I paid her $10 to say that. And I specialize in problems related to neck pain, back pain, and nerve pain going down the arms and legs.
Yes, and you're really good. So I've known Dr. Kim for a long time, and a couple years ago I walked into his office and I could hardly walk. I had sneezed or something and my back pain was so bad. Granted, this was from carrying around a child that I had just had, but also our lifestyle of golf tends to hurt our back. So I walked into his office thinking I was gonna need serious surgery. Discs were dislocated, and I was really surprised at the advice that I got. What did you say? Do you remember?
All right, first of all, this is a very common problem, and at some point I bet you everyone will have some episode of severe back pain and think, the world's coming to an end and I have to have surgery. Turns out the vast majority of people need non-operative treatment, and in your case it all boils down to fine-tuning your exercise regimen so that you take care of the muscles that surround your spine and basically act like the world's greatest back brace every day that you stand on planet Earth in 1G gravity. So okay. I would say in your case, which is very common among other people, you have two problems. One, your butt muscles, which when you're walking on four legs, you don't need that much. But as soon as you become bipedal, that muscle becomes very important for posture, balance, and not falling over and looking really kind of
right.
So if you don't exercise those muscles, they start to basically ache and get tight in its primitive effort to compensate for weak abdominals. It's kind of like, I have to stay upright, and one of the muscles that it employs, especially if you have back pain, are your pelvic muscles. So
is that part of, like, we need to make sure that our spine isn't as dipped as well? Like, you kind of need to tuck it in a little bit and have more of a straight back?
Yes, but it's even more subtle than that. It's about having a balance of muscle activity as you move around.
So what are some exercises that we can do to help that?
I would say the most common one is the one that affects the piriformis. So anybody that has back pain, I bet you they have severe pain right in their butt cheek, excuse me, sorry. This is G plus or PG13, and that muscle gets very tight and you can stretch it in a couple of different ways. If you're the type of person that always says, I'm so busy, I work all day long, I don't have time to exercise, you can do it in a chair simply by crossing your legs like a figure four, and while you're sitting, just lean forward and you'll feel a big stretch right here, and you can even grab one handrail and grab the other, or you can lay down on the ground and do it.
So if we lay down and we're like this, say we're watching TV, right? Just at the end of the day, what I would put my leg here and just kind of pull.
Yep, and when you do that, you should feel a big pull there.
Right, all this.
And you can also just let it fall this way, and now you'll stretch that way.
Like this?
Yep.
Okay. Oh, ow, yeah.
Yep.
Okay.
And then you can even get a helper to massage and roll that whole IT band area.
Got it.
So that's probably the most important stretch, most important kind of muscle to work on if you're going to start on something. In addition to stretching, the muscle has to be strong. So one good way to strengthen that muscle is if you're standing behind a chair, oh, I'm at work all day long, I can't leave. Just stand up, stand behind your chair, and you do these exercises. Hip extension or butt activation exercises. If you do 10 like this, 10 straight out, and 10 at an angle, making sure that this gluteal muscle fires. And you don't just swing it like this. I can do this all day. But this, Bruce Lee style, it starts to feeling like
steel.
Yes, my butt's looking so firm. And if you're going to do anything, those two exercises will probably take you most of the way there.
Okay, awesome. I love it. And the last thing you said to me was stop going freeway to fairway, get to the course, and actually hit balls on the driving range before you get out, right?
Did I say that? Because
you did say that.
I'm more about just stepping up and swinging as hard as I possibly can. But that's just my game.
Okay, I like it. Well, hope this was good for you guys. So thanks so much for tuning in. For more tips and tricks, please subscribe to my page.